Thanks so much, Dr. Battinelli. I'm Bertha Coombs. I'm a healthcare reporter at CNBC. And in this session, we're going to look at what we've learned from this crisis and where we go next. Under normal circumstances, healthcare in the U.S. can be incredibly innovative, pushing boundaries on medical treatments, while at the same time unable to get out of its own way to deliver on the promise of better care. And this COVID crisis has certainly magnified those disparities. Joining me to talk about this morning are Dr. Geoffrey Ling. He's the founding director of DARPA, Biological Technologies Office, and also the CEO of On Demand Pharmaceuticals, as well as Eric Schmidt, the former chairman and CEO of Google and the co-founder of Schmidt Futures, or rather the Schmidt Future Foundation, and as well, Dr. David Battinelli. Dr. Battinelli, let's start with you. Northwell has been at the forefront, really the front lines of this battle on COVID, starting very early this spring. What have we learned, and what have we learned at Northwell from battling this disease and really meeting this mission impossible?
I think that some of our earlier panelists have already discussed some of the critical issues, which is really to make sure that we're paying attention to the science, make sure we're paying attention to the data. And one of the things that became very clear for us at Northwell is we watched our frontline healthcare workers who initially were extremely fearful and understandable, but that fear morphed into courage. And I think it was because we were able to provide them with the proper PPE to protect them. And we also, as an integrated health system, were able to move our patients around to some of our other facilities so that nobody became overwhelmed. So that once our frontline providers felt that they were safe, or at least as safe as could possibly be expected, they were able to do their job. And I think that brought an unbelievable amount of appreciation from the community. We see that from the clapouts, from what FDNY did, but just the people in the neighborhood congratulating frontline workers at every change of shift. It was remarkable. So I think it reassured us that the people who enter healthcare do so for the right reason, and I think it helped the public understand that that's what frontline workers do, as Governor Cuomo just said. So we learned a lot about our frontline staff, our employees, and obviously there's lots to talk about with the science and the data.
Dr. Ling, you helped found the sort of science and biological technology area of DARPA. This is part of the armed forces to deal with these kinds of crises. Is it disappointing to see the fact that we just haven't been able to meet the moment? On the one hand, we've had 200, emergency use authorizations for treatments, for vaccine, candidates, and for tests. And yet at the same time, we can't seem to get the testing infrastructure working in this country.
Yes, well, I think that this COVID crisis allows us opportunity for reflection. So DARPA, the Defense Advanced Research Projects Agency, was actually born out of a similar type of crisis. The Russians beat the US into space by putting Sputnik up. And at that time, President Eisenhower felt the same. I'm sure that President Trump feels that, oh my goodness, how did we get caught off guard? How did this possibly happen? Where we have a military industrial complex that is well-funded, is staffed by some of the finest scientists in the world, of a country, the United States, which had a GDP 10 times that of the Russians, yet the Russians beat us into space. And so the conclusion was that there needed to be a new model. It didn't replace the old model, mind you, it was adjunctive to the new model, to the old model. And that is they created DARPA, a agency that had a very different way of doing things than the traditional model did. I would forward that this may be that Sputnik moment in the world of health. We have an extraordinarily well-funded biomedical enterprise here in the United States, second to none. We have the finest scientists in the world, second to none. We have a GDP that is exceptional. In fact, we spend equivalent to another country's GDP on this biomedical enterprise, and yet we're caught completely off guard. There is no vaccine right now. I mean, that's a fact. There is no therapy right now. That's a fact. There is no FDA-approved diagnostic. That's a fact. There's no prophylaxis. That's a fact. And Americans.
But we're also moving in quite literally warp speed, at hyperspeed, toward a vaccine. And we've never seen a development of a vaccine this quickly.
Well, that's because we're starting late. We are right of boom. I'm a soldier. And so the soldiers, when we look at a problem, we think of it in terms of when did the Pearl Harbor bomb fall? When did the boom happen? If you're right of boom, you have to move at warp speed. But why? Because Americans are dying every 80 seconds. 159,000 Americans are dead, and more are dying as we continue to move forward. So you have to move at warp speed. What you want to be in the future is to be the left of boom. And so I would offer that allows us an opportunity for reflection to say to ourselves, how can we improve this process? Dr. Cuomo, in fact, said that very nicely. He said that we were caught off guard. He said it in the last 2 minutes of his talk, and he's exactly right. We have got to get left of boom of these things. Otherwise, we will always have to be moving at operational warp speed because we're now playing catch up.
Eric, I want to turn to you about the role of technology here. You know, on the one hand, we have seen the ability of technology to develop these vaccine candidates in just record time. We have also seen how people have been able to communicate, it's interesting that doctors are using Zoom, they're using social media to communicate what they're learning in real time and being able to share that, not necessarily just have to wait for a publication in a journal. Yet at the same time, I can't help but feel that artificial intelligence is not helping us enough. Or am I just a little naive in thinking that we should be able to plug all this data into AI and for it to be able to help us solve this faster?
Off mute. We're not quite there yet. Let me start by saying my thanks to Northwell. When everyone else was running away from the problem, you guys ran straight toward it with courage that I've really, frankly, never seen. So thank you very, very much. And let's hope we don't have to do this again. I think if you look at the country's response in aggregate, it has been horrific. And I don't understand why, with all of the information, all the scientists, as the doctor said, that we haven't had a better response. We haven't had coherent federal dealing with people. And now we have this enormous pandemic going on largely in the South and the West and Southern California. So it does not appear to me that having all the information, which we do, is enough to produce the right outcome. And I think at the end of the day, the test is leadership, and AI is not quite there yet. What we do know, and I've been working a lot on this, is that, and Northwell has as well, is that telehealth is going to be a big component of the solution in the future. We know that essentially less than 1% of people would do telehealth, and that at times during the pandemic, it was 80%. And that's a sea change, something that we were hoping would take 10 years. We know that the reimbursement rates were not the same. Now they're the same, at least temporarily. We're working to make those permanent. The governor cleverly made a set of changes that allow the operation of the healthcare system to be more virtual and to use the communications tech tools that you mentioned. AI is being used in the development of the vaccines and the improvements of biology. And a silver lining of this terrible crisis is that biology is moving forward in its science and understanding at a rate that's never been seen before. They're running at a crazy rate of publishing new ideas and new investments and so forth. But viruses are hard and pandemics are hard, and we fundamentally have not come up with tools, as the doctor mentioned, any different from what we had in 1918, 100 years ago. So we should be able to do better.
How do we do better?
Well, I think it starts by agreeing to some basic rules, like wearing masks. What a shock. At Northwell, there were cases where you had a doctor and a doctor working initially, one with proper equipment, one without. One had it, one didn't, and it didn't transmit. So there's plenty of anecdotal evidence that masks work, PPE works, social distancing works. I do a COVID task force. It's very clear that super spreader events are the primary source of the disease. It's very clear that limitations on large gatherings are correct. It's clear that the government should be much more aggressive with respect to such rules. Right? In a pandemic, the rules have to be different. They can be temporary, but they have to be different.
Dr. Battinelli, after what folks at Northwell have gone through, how are you approaching care differently now, and particularly approaching the whole potential for seeing a resurgence here in New York of COVID cases?
Well, certainly under the governor's direction, we're maintaining our surge capacity so that should we need to adapt to a surge, we'll be prepared to do that. So that's built into what we do. But it's already been said, you know, what we have to understand in all our communities across the country is that this is, in fact, has been said, it's a pandemic. These things don't go away in months. This thing may take years. And unless people are prepared to understand that we need to stay safe in this fight through masking, social distancing, et cetera, we're going to have problems in the future. So we have adapted to that locally. We have made our places very safe. We are bringing all our patients back for their routine care, the care that was postponed when we stopped our elective surgeries, for example, and we're doing extremely well. And again, New York is doing phenomenally well with a very, very low prevalence of the disease. And it will stay that way if, in fact, we can convince people to pay attention to the science, to the data, to continue to mask, to continue to social distance, and be careful. But I worry that people think this is going away sooner rather than later.
I think it's tough to think that in New York after what we went through. I live around the corner from a hospital, and I still hear the ambulance wails every afternoon. So I know it's not going away anytime soon. Dr. Ling, what's next? What's the key issue that we need to tackle next, especially as we hopefully get closer to having a vaccine candidate?
Well, I think that the most important thing is to take care of the patients that we have today. I mean, I practice at Johns Hopkins, so I mean, I'm very familiar with what is going on. And the reality is we still have to take care of the patients today. What does that mean? It means that we have to do all the things that folks are doing, which is a good thing, right? We have to manage today. Then we can look for tomorrow. But right now we have to manage today. That means getting PPEs to everybody who needs them. That means doing the social distancing that Mr. Schmidt and Dr. Bertha are talking about. That is absolutely critical. These are things that everybody can do. We also have to recognize that we have identified certain vulnerabilities in our own healthcare system. For example, our dependence on overseas suppliers of medications, for example. And we're trying to address that ourselves out of the DARPA program that I've turned into that company by building a 3D printer, about the size of a refrigerator, that makes medicines from U.S. domestic sourced precursors. That's only a small example. We need examples like that in diagnostics. We need examples like that in vaccines, and the beat goes on. It is an opportunity. And yet again, it is an opportunity for us to change business as usual in a rational, scientifically driven way. But we have to take care of the patients today.
And Eric, what are you seeing that gives you hope that we're perhaps moving to the next chapter? You know, Anna Lamont in the session before talked about telehealth as well, and saying how we are moving more care into the home, and especially now that we have these companies that are able to do in-home testing, so you don't even have to go out for that necessarily. It seems as though we are moving along on that, and that could be one of the gains that we get from this crisis.
There's no question that some things that should have occurred sooner are now going to happen very soon, telehealth being one. There are all sorts of problems with people getting access to telehealth, for example. In the Northwell community, there are many underserved communities who have trouble even getting access to a mobile phone, and often in a language that people don't speak commonly. And so these are technical platform challenges that Northwell's technical team is trying to work on, and they're doing a good job. Let me say more generally, I remain pretty upset because we as Americans are better than what we're seeing now, right? We have heroes like Northwell, but the country as a whole has not risen to the challenge. We are in a pandemic. The pandemic requires temporary adjustments of some of our expectations. A relatively straightforward plan over the next month to get R0 from roughly 1.1 or 1.2, whatever the current numbers are, materially down, which is what Governor Cuomo and the team in New York, including Northwell, did in basically April, would help solve this problem. We are at collective risk because the collective of America is not doing the hard stuff that New York State had to do. And nobody wants to face this. So I'm going to say it right now. You're going to have to either have another lockdown, which nobody wants, or you're going to have to simulate one. And the best way to simulate one is to have mandatory masking, avoid crowds, force people to stay inside, avoid the sort of modes of transmission for 2, 3, 4 weeks. Can you get through that? You already did in New York. Why can't the rest of the country get through this too? And then we can get on to being back to being Americans and having a good time.
But is it maybe I was reading one article that sort of says it's our rugged individualism, that sort of American idea as opposed to the collective.
I love the idea that I can do anything I want. If you assume that 70% of the infection is pre-symptomatic or asymptomatic, I guess that includes my right to infect you and kill you. The logic just doesn't hold. And somebody needs to call it, right? The fact that I'm wearing a mask is a statement that I'm trying not to get you sick, because I don't know that I might have the disease. I find this logic just incredibly frustrating, right? Where did our care for fellow humans, our shared experience as humans? I would never want to make anyone sick, and I can't imagine anyone else would do. Wear a mask.
I guess maybe we can talk about it as a sense of empowerment, that it's the thing that we can all do as individuals to help.
I personally believe that a lot of this has to do with, it's a leadership crisis, but it's also sort of an intelligence crisis. The people who are leading the country need to basically sit down with the smart doctors and be informed by science. Last time I checked, science still governs the way we have to live in our society and on Earth. And so unfortunately, the virus is not just going to go away even if we wish it. And in fact, there's lots of evidence that the virus will be with us for many, many years. So we're going to have to make accommodations while maintaining our liberty and our freedom. But what about dealing with the inequality that the pandemic is bringing out? The biggest source of inequality in our society is the pandemic, because of the people that it's affecting so severely who are not as privileged as I am. I worry a lot about this. It's time for action collectively as a society to get back to Americans' vision of opportunity, growth, and the general well-being of our society.
Dr. Battinelli and Dr. Ling, I'd like to give you each a chance to also sort of give the last word here. What do we need to do next? One concrete thing. Dr. Ling.
Yes. Oh, no, we need to do exactly what Mr. Schmidt said. We have got to start looking after each other. We have to stop thinking about ourselves. This is about a tragedy. World War II was a classic example of the country under attack, and the company came together. This country has to come together. And it's really the simple things that each of us can do. Wearing a mask, social distancing, washing your hands are simple, straightforward things that everybody can do to take care of each other. We've got to get into the mindset of it's not about me, but it's about us.
And Dr. Battinelli.
Yeah, I'd just like to add that I think there needs to continue to be an appreciation that healthcare does not just fix broken bones and take care of car accidents, but we are here to protect the community. And when things such as this happen, we have the staff, we have the frontline providers, the doctors, the nurses, the administrators who are passionate about that activity, and we will be here to protect the community.
Well, thank you all for what has been an incredible session, and hopefully this word gets out further that one thing we can all individually do, even if we cannot solve the crisis, we cannot cure the disease, we can all do our part to work together. Thank you to Northwell for inviting me once again to speak at this forum, and hope all of you will continue to enjoy the discussion here. Thanks again.